Today we're going to learn about the extrinsic and intrinsic innervations of the GI tract as well as a clinical correlate, Hirschsprung's disease. The extrinsic innervation involves the sympathetic and parasympathetic systems. First, let's focus on the sympathetic system. It arises from the T5 to L1 vertebrae. The preganglion fibers synapse outside the GI tract while the postganglion fibers enter the gut via the splanchnic nerves. The preganglionic fibers use acetylcholine, and acetylcholine interacts with nicotinic receptors on the postganglionic fibers. The postganglionic fibers use norepinephrine, and the inferior mesenteric ganglia are where these preganglionic and postganglionic fibers synapse for the colon specifically. Norepinephrine via the sympathetic nervous system has an inhibitory effect on the colon, and it causes a decrease in colonic motility. To help you better remember this, remember that your sympathetic nervous system gives a fight or flight response, and being chased by a bear is not a convenient time for a bowel movement. And now onto the parasympathetic nervous system. The vagus nerve innervates most of the GI tract, including the ascending colon. The pelvic nerve innervates the rest of the colon distal to the ascending portion. Preganglion fibers synapse either in or near the target organ. The ganglia are located in the submucosal plexus and myenteric plexuses. From here, the postganglionic fibers are classified as either cholinergic neurons that release acetylcholine or peptidergic neurons that secrete substance P and vasoactive intestinal peptide, or VIP. Remember, the general function of the parasympathetic system is to rest and digest, and this increases colonic motility. Moving on to the intrinsic innervation of the GI tract, or the enteric nervous system. Cell bodies of the system are clustered in ganglia that are interconnected by fiber tracts to form a plexus. There are two main plexuses that we have mentioned before, the myenteric and submucosal plexuses. The main neurotransmitters involved are either stimulatory, such as acetylcholine, neurokinin A, and substance P, or inhibitory, such as the vasoactive intestinal peptide and nitric oxide. The enteric nervous system can direct all functions of the GI tract even without extrinsic innervation, and it controls contractile, secretory, and endocrine functions of the GI tract. Hirschsprung's disease. Hirschsprung's disease is a congenital defect that results when neural crest cells, or precursors of enteric ganglion cells, fail to migrate during development of the intestine. Ganglion cells end up missing in both the submucosal and myenteric plexuses of the bowel. This actually results from mutations in the RET proto-oncogene that codes for receptor tyrosine kinase. This receptor tyrosine kinase is crucial in the growth and differentiation of developing tissue. Normally, activation of enteric nerves causes the bowel to relax, but with the ganglion cells missing in a certain part of the bowel, that affected portion remains in a persistently contracted state. The majority of people with Hirschsprungs are affected in a short segment of the distal colon. Only some individuals have longer segments of their colon affected, while 5% of those with the disease have their entire colon affected. It is even more rare to have the entire colon as well as part of the small intestine affected. The persistently contracted state of the bowel, however, leads to dilation of the bowel proximally because of the backup of the intestinal contents. Symptoms in neonates include bilious emesis, abdominal distension, failure to pass stool, and delayed passage of the first meconium. If diagnosed later in childhood, one can expect to see chronic constipation or even a failure to thrive. And a major complication of the disease is enterocolitis. Here you can see a distended transverse colon proximal to a constricted descending colon that is affected by Hirschsprungs. Treatment of the disease can involve a resection of the abnormal denervated segment of the bowel. The usual treatment, however, is what's called a pull-through surgery, where the portion of the colon that does have nerve cells is pulled through and sewn over the part that lacks nerve cells. And that is the end of the lecture. Thank you.